I'm Dawn Laney. I'm a genetic counselor by training. I've worked at Emory now for almost 20 years, and the last 18 or so of them have been exclusively in lysosomal storage diseases, including Fabry disease. I'm very fortunate that I've been able to continue seeing clinical patients, even as I've moved into the directorship for the Genetic Clinical Trials Center and the head of the Lysosomal Storage Disease Center. But spending time with my patients is really what reminds me of what's important and really what guides the research that I do. So the most recent thing I've been working on, in addition to my usual stuff, is trying to figure out how best to think about COVID disease when it comes to Fabry disease, which was a much scarier thing back when we were planning this conference, but still think is very important for us as we move into this next phase of working in quarantine. So I think this is a really nice follow-up to what Dr. Nadia Ali presented with our last session. So I'm going to share my screen and we'll talk COVID. All right, so these are my disclosures. I like Rob's disclosure, which is that he'll talk to anybody who talks to him about Fabry disease. I'm about the same. I really just want to know what's going on, and I want to know where things are, and I feel like sometimes I'm able to help people understand what it's like to work with patients with Fabry disease and, you know, really connect them with people who have Fabry disease, because you are the ones who help people understand what it's like to live with Fabry disease. And I just tend to synthesize and publish what you tell me in an organized fashion. So what is COVID disease? Well, so I thought the first thing we should do is talk about terminology. When we first started learning about this condition, I know we talked a lot about corona, because there's all sorts of great memes about coronavirus, right, with beers and things. But really, corona is the name of the disease. So when you get ill with the flu, it's kind of like getting ill with COVID-19. So that's the illness that you have. And it's caused by a SARS virus. It's severe acute respiratory coronavirus 2, or SARS-CoV-2. So when somebody is reading a paper, if you're looking up things about COVID-19 and what it means for Fabry disease or what it means for, you know, your family members, that's the terminology to think about. COVID-19 is the illness, and then this SARS-2, COVID-2, is what causes the problem. So it's like two different things. It's kind of like HIV and AIDS. AIDS is the disease and HIV is what infects you. So same sort of thing with coronavirus. When we think about transmission, we've learned a lot about transmission over the past 6 months. And what we've learned is the most frequent way you're gonna get COVID-19 is from, you know, wearing masks like this, and then having, this is a too thin mask, by the way. This is the one they don't recommend, but it's from Victory Junction and I love it. And it wasn't originally meant to be a COVID mask. Anyway, it's very thin. And when you put it over your mouth and breathe out, it breaks up the particles and makes them in droplets. And those little droplets are what does the best job of transmitting transmitting this virus that causes COVID-19. So when you wear the masks that are 2-layer, double layer with thing, that keeps all your aerosols in with you and doesn't give it to other people. And the same from other people. When they send their aerosols out to you, it'd be better if they're wearing a mask so they could stop it. And then things that have just one layer that's very thin tends to break up your droplets so that they're more aerosol than they travel further. But the good news about aerosols is they're up and they're floating and eventually they come down. And sometimes when they come down, they're gonna land on something like an elevator button, or somebody will cough on their hand and press an elevator button. And that can transmit as well, but it doesn't live for a really, really, really long time on elevator buttons. The most likely way you're gonna get this is if somebody's talking near you, laughing, singing. We've all heard about the choir who was singing and everybody got the infection, including the congregation. So that's how they learned that aerosols is really the way it transmitted. The most common symptoms you see of the starting of the disease or the milder form of the disease would be fever, that's a big one, loss of smell and taste, shortness of breath, coughing, sore throat, fatigue, and that can turn into pneumonia. And pneumonia is what then can lead some people to go into the hospital. But there's a huge range of symptoms, and we've seen that in the news reports we've heard about. There's the very subclinical way where somebody says, oh, I got tested at college and this child has Fabry disease. I mean, sorry, Fabry disease. This child has COVID disease, but in this case, they're not having any symptoms that we really can tell. Maybe a stuffy nose, maybe a little bit of loss of sensation, but not something that they'd know walking around with. Mild disease is more like your colds. Moderate disease is that pneumonia that puts you in the hospital, or the other breathing problems that cause problems for you. Severe disease is when your organs start shutting down. So this is the most severe form of COVID, where I think it was Dr. Lau mentioned. No, it wasn't Dr. Lau. Who was it? Oh, anyway, one of our other speakers mentioned the severe impact and heart disease and kidney disease and pulmonary function that can happen in severe disease. And then, of course, the worst thing we think about with COVID-19 is passing away, is death. And this is what severe infection looks like. Severe respiratory, so breathing problems, that pneumonia, GI problems like worsened diarrhea, and then gradually, you know, you may not realize you're walking around without being able to breathe as well as you can. So when you go to the hospital, then you crash. This is kind of the story of the early COVID days. This is what we saw at Emory, which is a hospital that took care of a lot of COVID patients. People coming to the ER feeling very sick. They just got progressively worse and then ended up in the hospital. Critical infection is when, you know, you go through all these steps, but then all your organs start shutting down as well. It's not a very pretty picture, right? Well, okay, thanks, Dawn. I appreciate the COVID lesson. Great. So what does it mean when you have Fabry disease? Well, when we're talking about Fabry disease, we're talking about your own personal immune system. We're talking about what Fabry disease has happened to you. And then we're talking about COVID-19 symptoms and how the disease is impacting you. So that's what I'm really going to spend most of my time is on, the impact on people with Fabry disease. So when we talk about Fabry disease, being at risk in the general population overlaps with being at risk when you have Fabry disease. So if you are over 65, if you already have a decreased immune system, whether it's from a condition or being on transplant medications or daily steroids or some other reason that you're on something that's going to decrease your immune system, or if you already have existing heart disease, a chronic health condition like diabetes, lung disease, or kidney disease. So these would be folks who have Fabry disease, have these complications. They're at the same risk as somebody who's out there, the general population, with a similar thing not caused by Fabry disease. So that's our at-risk population, right? There's the ones who are most worried about getting severe Fabry disease. I mean, COVID disease. My brain's gonna have to move from Fabry to something else. But how about everybody else? So if you don't have serious heart disease, you're not end-stage renal disease, you're not on transplant medications, what does that mean for you in Fabry disease? And some of you in the community have been very generous about talking to me about your Fabry symptoms. I also have joined with a group of international experts in Fabry disease around the world, from Europe to Asia to South America, all around the world, to really try to understand the impact of COVID disease and how we think about Fabry disease as a risk factor for more severe disease. Now, this is based on the cases that we found, in with some theoretical thoughts too. And you'll see it's kind of like a choose your own adventure, right? You're like, okay, so I'm 47 and I have non-classic Fabry disease and I don't have kidney disease, I haven't had a transplant, I haven't had a stroke, I'm not a smoker. Okay, there I am. So you're just trying to find on both sides of this pyramid where you best fit. And then I want you to realize that if you get pain crisis with fever, if you get COVID-19 disease, you're most likely going to have pain crisis, right? That doesn't go away just because it's a different thing that's causing your fever. So this is where we hear stories about children who are just miserable, even though they didn't have the risk factors we were just looking at, because they have Fabry pain crisis, plus they have the underlying COVID cold-like symptoms, which can take them from what would have been a mild condition into a more moderate, serious condition. So let's practice. All right, pull out your comments here. If we're looking at this pyramid and we're looking at a 25-year-old man who's got bradycardia on his EKG and fatigue, but he doesn't have any kidney disease or heart disease, where would you put him? Would you consider him more in the yellow region, more in the red region, or more in the green region? All right, let's see. I'm working on seeing your comments. It's harder than you think when you're sharing this. Oh, now I've got subtitles. All right. Okay, so that's kind of an exercise, right? Okay, let's try it again. Let's try, so usually what we do is we look on this right side, we say, okay, he's youngish. Hold on, I just saw what I need. Whoop. You're watching my thing scroll around, right? There we go. Yes, I started at Emory when I was 5. All right, so let's look at what's going on here. Okay, so I want you guys to put in the chat where you think this young man would be. So when I look at this, I say, okay, he's 25-year-old, and he's got bradycardia, and he's got what looks like classic disease, right? We're gonna say it's classic. He's got fatigue, but he doesn't have any kidney function. So I would put him right here where it says sort of an inching into yellow. Does that make sense? All right, so let's look at another one. Let's look at 40 years old, non-classic Fabry disease, mild Mochavev prolapse, but he does have LVH. All right, let's look. On this side, late onset, no target organ injury. Well, he's got some heart stuff, right? Okay, so that moves him up a little bit. I didn't tell you he was a smoker or anything. He doesn't have severe LVH. So he's somewhere in here on this side, but looking over here, okay, he doesn't fit in this category. He's not necessarily young, but he is a later onset male. You might fall into other Fabry patients, right? We talked to Dr. Rob talked about how we've got this spectrum, so it's hard to say like this way or that way. But looking at this, it looks like he would probably fall right here too. How could that be? That's two very different people of different ages. Well, this is all a guessing game, right? It looks a little bit more yellow. Somebody said red. Yeah, he's not quite there, fortunately, because he's not significant LVH. And that's where you have to talk to your doctor, like how serious is what we're looking at. When we looked at bradycardia on the EKG for this young man, our first 25-year-old, we considered it a milder thing because he doesn't have symptoms with it or LVH or other heart issues. But in some other people out there who are symptomatic, that bradycardia could be a bigger deal. All right, so let's look at this one. 60-year-old woman with classic Fabry disease, severe LVH and proteinuria. Looking on the left side, I didn't tell you about smoking. I didn't tell you she didn't have a heart transplant. She doesn't have a stroke or white matter lesions I told you about. She does have LVH, right? Oh, I'm seeing some oranges. Good, good, good. All right, not young. No evidence of disease. Nope, she's got disease. Could be kind of here-ish, but non-classic above age 55. Oh, there we are. So that would be more of an orange, right? Do you see how you use this? It's just a way of trying to guess a little bit of where you might fall in there. All right, let's see. Okay. Now let's see how that really comes out. All right. So I just gave you this great way to kind of predict where you may fall in there. I'm here to tell you that not everybody's going to work on that chart, right? We just try to give it our best ballpark so people can get a vague idea of where they may fall in there. But you have to talk to your doctor because there may be other things we're not putting in there. In all of that pyramid, you didn't see any comments about, you know, did anybody have diabetes? That wasn't in there. There wasn't any comments about other concomitant conditions. There was smoking. That was a good one to look at because they're worried about pulmonary function, but it didn't talk about hypertension. So these are other risk factors that are not in that triangle. But I feel it's nice sometimes to at least have a kind of a framework to think about when you think about where you may fall in a risk for severe Fabry disease, severe COVID-19. Recognizing though that this is not perfect. This is not how we're gonna be able to figure out everybody's risk, but it gives you somewhere to start, somewhere to think about it. What should we be doing? Well, Dr. Rob talked a little bit about this morning. The best thing to do, no matter where you fall in that pyramid, is to wear a mask when you go out. When you're home, like we are now, don't worry about it. You don't need to wear a mask at home. Unless you have COVID-19 and someone in your household does not have it, which is possible, definitely possible. But when you're out and about, wearing a mask is your best protection. Trying to avoid all those aerosol particles that could have COVID-19. If somebody isn't wearing a mask around you, try to stay at least 6 feet away. Is that the perfect magic number? No, it is not the perfect magic number, but it's what they feel can give you a little bit of distance from those aerosolized particles. And that's where you see some people doing social distance picnics, right? Somebody's sitting over here, somebody's sitting over here, they take it off their masks and they can have some food to eat and then they put it back on if you get closer. These are options. Now, you have to decide for yourself how comfortable you are with things like that. Wash your hands a lot in case those aerosols particles are around. If you're going somewhere where you're going to touch doorknobs, you're going to touch buttons, consider using gloves or taking paper towels or things where you can avoid it. In the past, I've used my sleeve, so I'll pull it over my hand and open a door. I'm in the hospital all the time right now, you guys, so it's best to do this. Somebody said, I see people wearing the mask and not covering their nose. I know, I see that a lot too. And she said, if I say something nicely, they just don't care. Yeah, I wish that we had a way where we could say like, everybody please wear it. And you know, if you're someone who's at risk, it's a big deal. But at this point, people don't necessarily do that for you. And that's where you end up being at home, being around your house, being a little more isolated to avoid some of that, which, as Nadia just talked about, can also lead to some other, you know, fatigue and just making us more frustrated, more sad, you know. But don't stop the things that are keeping you as healthy as we can keep you healthy. Keep doing your Fabry specific enzyme replacement therapy or chaperone therapy. Keep doing dialysis. Now talk to your doctors about ways you can get these medications that might keep you a little bit further away from people. One of the things that we talked about with one of the folks who's an expert in France was that in France, there's like a group shuttle that takes different people in an area to go get dialysis all together. And they talked about how they had to break down that system so that people weren't all, who, you know, were already having severe kidney disease, weren't all together and at risk for COVID passing to each other as they took the group shuttle to dialysis 3 times a week. In this case, chaperone therapy, you can take at home. Other medications that you sometimes would need to go to the pharmacy to get, there's now a lot of ways where they can do ship to your home. There's several pharmacies now that'll deliver to your house. Now it all depends on where you live and where your area is. I live in the city. It means we've got more accessibility to this types of services. If you live further out, you may not have as many options, but you also may have less people around. So you do have some flexibility there. Really, we want to keep you as healthy as possible so that when these cool new therapies come around, then we're able to get them to you and it'll do the most good possible. And we also want to make sure you don't get COVID-19 if at all possible. We just had the most amazing talk that talked about ways you can keep doing activities and keep your mental health together. And this is so important because as we're all sitting around, you know, with Fabry disease, we know there's an increased risk to have anxiety. There's an increased risk to have depression. And if you throw COVID on top of it, then it's just going to make it harder. And so if you can do activities that still bring you some joy, find ways to consume things that make you happy. My personal joy is chai tea every morning. I do the drive-through with my mask, and the masked Starbucks person gives me my chai tea, and I am happy. It is just something that's kind of like, here's your reward for going to work in a pandemic. And it's a little thing, but it makes me happy. The other thing, I did that baking thing for a while. I've definitely been doing walking things. And then spending time with my children has been, of course, very important. My family, my dad is one who should not get COVID-19. He has a genetic condition that's not Fabry disease, and he has a big old aorta that we're just waiting. He's got a couple more millimeters before he needs a Teflon aorta. But in the meantime, he does not need COVID. So he's been very strict about quarantining, but he's got a more active social life than me. His family, his friends and all, they do parties. Like he had 4 Zoom parties one night, just one after another. And my parents like got a green screen so they could put up the tropical background. And, you know, like, why not? Why not be happy? Why not recognize that, you know, everybody in your family is a little at risk and do some crazy things over Zoom? My brother is the master of the weird Zoom backgrounds. So he's always a fun one to Zoom with. In this particular screenshot there, that's my sister and myself and my brother and my parents. And my parents somehow managed to put a picture from, that would have been 1991, and then inserted themselves in their picture. So this is something that gave them great joy, and it made us pretty funny too. All right, so one of the things that we've tried to do is how to think about a plan. So some of the most at-risk people in our practice at Emory are folks who have had renal transplants, and they are on medications that decrease their immune system, and they are the highest risk. And it's interesting because the best place or the best people for them to talk to if they think they have COVID is actually the transplant team, because the transplant team has a direct line to get people tested, to keep them out of the regular ER, and really to get them in an isolated place, because they're worried about the kidney and they're worried about the person too, right? So my plan for some of our patients who have renal transplants is call your transplant team, and they've even got a hotline for them to talk to so they can get them safely tested, and if they are affected, get them the best care they can get. Now, we're lucky that we have that. If you don't live as near to a transplant team, then that, you need to talk to your primary care about who would be the best person, the best path for you. The other thing we've learned about COVID over the past 6 months is if you have the initial symptoms, don't wait. Like, go ahead and get tested, find out you have it so you can get care as soon as possible. And that's particularly in the high risk group or the moderate risk group, because people with COVID-19 can walk around and be pretty sick and not realize how little oxygen they're actually getting. And this has some of those warning signs from the CDC on here. When we talk about COVID treatment, if you have Fabry disease, it shouldn't matter. You should get everything that anybody who could get COVID should have. If that's having severe Fabry disease and needing dialysis, then you should get dialysis. If you're having severe Fabry disease and you need a respirator, you should get a respirator. Fabry disease should not keep you from getting the best care possible to treat COVID disease. However, one of the things that we do know is that you have to look and see if the medication they're trying is something that doesn't help with Fabry disease that could cause problems. And some of the treatments that were offered earlier are actually probably the worst thing we could give somebody with Fabry disease. So I'm sorry, I can't remember the hydroquinone. Hold on. There was a medication, hydroquinone. I got to make sure I'm not talking about the. Somebody's going to tell me in the comment. There we go. I can't say it. Hydroquinone. Anyway, it causes arrhythmias with the heart. And if you have Fabry disease, the last thing we want to do is get your heart to have additional arrhythmias. The other thing that you see with hydroquinone is it actually causes more storage within the lysosome of basically GL3s. So people who take that medication, we're now going to have to know that in the future, if they have a biopsy or they may have corneal whorls that could make it look like they have Fabry disease, but really they just took this medication. So if you combine that tendency of this medication that interferes with how your lysosome works with somebody with Fabry disease, and if they're on enzyme replacement therapy, if they're on chaperone therapy, interferes with the ability of that treatment to work. So they're medications you should just avoid in general. And in this case, now we've learned it doesn't seem to help COVID disease so well. But early days, we didn't know that. And so we always say, if there's a new medication that they're talking about for COVID treatment, make sure we know what its mechanism is and make sure your doctor is checked to see how that might impact your Fabry disease and your treatment. Things you never thought you'd think about, right? And just keep in close communications with your doctor. If you're worried about something, know the best way to talk to your doctor about it. Know how to reach his office. You may not be able to talk directly to your doctor, but is there a nurse that you can leave a message for who calls you back in a timely manner? Know who on your study team is your contact person for these things. If you're supposed to go straight to the ER, know that ahead of time. If you're supposed to talk to your transplant people, know that now when you're healthy and at home, and not when you're trying to figure it out when you're feeling ill. The best way to get tested in your neighborhood, figure that out ahead of time. That's something that can be very simple, like drive-through, or it can be very complicated. So you want to know all those paths ahead of time. And communicating with your care team is going to be the best way to know those things. When the vaccine comes out, then folks with Fabry disease in the Fabry community should be the people who receive that. There are 3 baskets of fast food right here. Okay, thanks. Dinner's here. You guys want some dinner? So when we think about the vaccine, we want to make sure that you are getting a vaccine that's already been scientifically vetted. Somebody made that point early on that you just don't want to get any vaccine, do you? I was like, no, no. Make sure that we're getting vaccines that's already proven to be safe and effective in clinical trials. Now, the FDA should not approve any medication that's not been proven to be safe and effective. That's what they should be doing for you, so you don't have to worry about it. But it doesn't hurt to run it by your care team first and say, okay, this is the vaccine that's available here. Is this the right one I should be taking? Because there's competing vaccines being developed for against COVID-19 right now. And what we'll need to do is make sure that we understand the effectiveness of them and make sure you're getting the right one.
Can I get some takeout?
Yes.
Yay.
Yes, balancing life. Yeah, so that's the message. And right now, get your flu shot. There's a lot of ways you can do with low contact, get a flu shot. I got mine at my local Publix, which is our grocery store. And you basically signed up, left the building, and they text you when you could come back. You're in one place, one person gave you a shot and you went back out again. So there's different places where you can have low contact and get that flu vaccine, because you don't want COVID plus flu if you can help it. Now I say that with the caveat, you need to talk to your doctor before you get the flu vaccine if you're allergic to eggs or if there's something that would keep you from getting that vaccine.
What can I get?
My 10-year-old is very concerned about the amount of food he can get. All right, let's see here. Okay, do you see that little tiny baby on the back of that screen? That is my 10-year-old now, so I need to update that, but I just like the picture, so I keep it in there. So what I'm gonna do now is go look at your comments, because I see some comments and questions, and we can look through that. And go ahead and submit any questions you have or any comments that you want to talk to about COVID. And if I don't know the answer, I can work on finding it for you. All right, let's see here. When I have the slides up, it's hard to see the comments. So I'm going to go ahead and stop sharing those. And if we want to go back to one of the slides, we can. All right, let's see here. To ask the question about when I started at Emory, it was 2002 when I started at Emory, and I was not 5. I wasn't even 21. How old was I? I think I was 30 maybe. No, not 30. Anyway, right in there. 30, I guess I was 25 when I started at Emory. When is the best time to get a flu shot? Early is the best time to get a flu shot. So if you're in the earlier people, then you'll know that you'll get the vaccine. Sometimes they run low on flu shots. It doesn't seem to be a problem this year, but you never know when that might occur. But again, talk to your doctor and see if there's a particular one of the flu vaccines they'd like you to take. At Emory, we all have to get flu shots, and there's a couple different kinds around. There's different ways of giving them. So I would check in and see what they prefer. You guys doing a great job over here with trying to figure out where different people lie on the pyramid of COVID. Someone mentioned here, after having a transplant 15 years ago, I stopped touching doorknobs, elevator buttons, any in the public bathroom. I use paper towels or Purell. And that absolutely makes sense. When you talk about the chance for getting a virus or an infection, things that are touched the most, you know, people sneeze and they touch the thing, you know, and it's better to be safe than sorry. Use paper towels, use Purell. Yeah, and it looks like Sharon has had a great transplant team who taught them exactly what to avoid. And I think that's very true. You know, if you have a transplant, typically you've got a transplant coordinator who helps you with your follow-up appointments and can give you some advice on what to avoid. There you go. You're right. Hydroxychloroquine. Yeah. Yep. Someone actually was trying to give hydroxychloroquine. Yep. And it can rate up. And you're exactly. So even before COVID times, taking this medication does cause storage. There's a couple medications that cause storage like this. So there's a medication called tamoxifen that you can take if you had breast cancer, and then they give it to decrease the chance for you to get breast cancer again. So that's one thing, it causes storage like Fabry disease does. There's a medication, amiodarone, that I actually mentioned a little bit earlier during one of the cardiac talks. When that stores, it can also cause, that storage that looks like Fabry disease can cause corneal whorls. There is, we just talked about the chloroquine, hydroxychloroquine can do it. And what else? Cactus. There's a cacti is the thing. And oh, indocin. You don't get indocin very much. Typically they give that to babies who have a PDA, a little tiny heart opening between the two vesicles, and they use that to close it. But those are things that if somebody's on, it can look like they have Fabry disease even when they don't. All right, your GP told me. Okay, so when we talk about vaccines, you know, there's some very, very strong opinions about vaccines and taking vaccines. In this case, in the world of Fabry disease, just make sure you're taking a vaccine that is shown to be safe and effective. And we're not worried about, you know, people being traced through vaccines. We're not worried about, you know, autism and things like that with these vaccines. We're talking about very, you know, straightforward vaccines. This is the flu vaccine, and this is the hopefully future very safe and effective COVID vaccine. And if you have concerns about theories, and if you're talking to a healthcare provider and it doesn't seem to jive with what you're hearing, feel free to do another check with someone else or look at the CDC website, which can have some other problems sometimes, but for the most part, very reliable, good, strong information there. Other people are eating dinner too. Not too early for flu vaccine. In fact, they started doing flu vaccines for us in September. Somebody asked what a GPA. I was thinking general practitioner. I'm not sure if that's what we're looking for there. Linda, if you want to do a GPA. Good. If I had a severe reaction to the flu shot and my doctor told you never to have it again, does that mean I can't get the COVID vaccine? No, because it depends on what they use to make the COVID vaccine. So a lot of people for the flu shot, they reacted to the egg products that are in that flu vaccine or something else that was within that vaccine. They make vaccines in different ways. You know how with enzyme replacement therapy for Fabrazyme, they make it in Chinese hamster ovary cells, or they make it in carrot cells, they make it tobacco cells, they make it in human cells. Same thing with vaccines. They make it in different types of cells. So you need to know, working with your doctor, which vaccine has a thing that they think you're most likely to react to. And if they do say there's no way you can get this COVID vaccine, then that means that you will have to continue on and hope that the people around you all get the vaccine, so you have a bit of herd immunity is what they call it. You can't get it, everybody else around you needs to have it so they can make you safe. General practitioner, yeah, that's what I thought. So GPA in this case meant general practitioner. Someone asked, can Fabry patients go to work during the pandemic if they are careful or are they a high-risk group? So we looked at that pyramid. Everybody falls within a different part. Oh, look, Angela's with Jerry. That's the best thing of the evening right there. Awesome. Okay, so everybody's a different risk level as we looked at with that pyramid. So if somebody falls into a risk category that's in the green and the yellow and the orange, then they have to decide for themselves what their job entails and how much public contact and what level of risk they feel they are, and they can talk to their doctor about it as well. We have many patients who are going to work. They wear masks, they make sure they're isolated when their masks are off and they're eating. But we have some people who cannot, and we wrote letters for them saying, you know, this person has had a renal transplant, is immunocompromised, they can't work the meat counter. Like there's no way this person can come into contact with people all day long, and suppliers and all the people they'd be exposed to if they were working in their normal job there. So it depends on your health, it depends on where you work, and it depends on how your doctor feels that risk would be for you. One list. You know, that's actually something, Jerry, you might consider. Looking at a list of drugs that are contraindicated in Fabry disease. That might be something to talk to our medical advisors about in Fabry disease and see if we can make a list. That's a really good idea, Donna. Linda, I hope your GPA has additional charms that aren't related to his thoughts on vaccines. All right, So while we're here, why don't we go ahead and do our prize drawing? The secret word for this one is going to be COVID. So put your name, first and last name, and COVID into the comments, and you will be entered into the prize drawing. Nice. There we go. I am done. Do you guys have any other questions for me related to the meeting or COVID or studies? I don't know. Anything you want to know? Hey, Julie. I like seeing the responses and the interest into the drawing because that also it lets me see who's on the call when I'm not like scrolling through all the pictures.